Yohann, your host for this session, and thank you for tuning in. That's it. If you guys want to contribute to our topics, have any questions, or just want to tell us what an amazing job we're doing,
Hi everyone.
yeah. So this is our special guest for the show. We have Dr. Jyotirmaya Das, who is a senior cardiologist, MGM Healthcare Aminjikarai, which is in Tamil Nadu. It's indeed a pleasure to have you on the show, sir.
Thank you so much.
Yeah. So, for this edition of the Reality Pine, the doctor and I will be having a discussion regarding this very important topic for World Heart Day, and we'll give you guys a better viewpoint of this entire topic. So, my first question to doctor is going to be now, what is the significance of World Heart Day?
See, World Heart Day is a very important, no, I will say it's a landmark day. Why? Because this is the day where we not only we impart the treatments, but also we educate the society in the form of giving talks, in the form of not only the society, the say it's a institution or any hospital heads or any the say political heads or business heads or the college heads, all those people we used to tell or we used to impart this thing that how to get this health for all. The we are dreaming of health for all. So in that process, what we can do to get this health for all thing. So we involve a lot of things. Not only this, we used to go for medical things. We used to go for say treatment. We used to say that get your health checked, get your blood pressure checked, get your sugar checked. So all those things we used to incorporate on that particular day. So it is not only we are educating or we are telling, we are also helping the society in getting streamlined. So because many people, as you know, they might not be knowing what is the implication of getting a healthy heart. So this is the day where we just put our heart and soul into it, so that a lot of people, as many people as we can, should come into the ambit, and then we can deliver that healthy heart thing, and so that their heart remains healthy.
Okay, that was a very good one. Now, of course, now we have the second question coming up, and now they say cholesterol is a huge link to heart diseases and heart attacks and all of that. So, what exactly is the link between cholesterol and heart diseases?
Yeah, see, cholesterol generally, when we talk about cholesterol, we are talking, many people that talk about the total cholesterol. We are not
Yeah.
talking about the total cholesterol. We call it as a lipid profile. Lipid profile means there will be total cholesterol, there will be diet related triglycerides, there will be a protective cholesterol called HDL, there will be a bad cholesterol again, which is called as a the LDL. There is one more cholesterol called non-HDL, that is again a bad cholesterol. There is a ratio, HDL cholesterol ratio. So all those things it's very important. Why? Because out of all this, whatever components I have told in a lipid profile, the most important thing is the LDL. LDL is sometimes we call it as an attack cholesterol. So people who have a high LDL values should be treated, or should be at least given a lifestyle modification as the first option. And because, as you know, the cholesterol doesn't get deposited all of a sudden, or the heart attack doesn't happen all of a sudden. It is a continuum process. So as far as the if you see the history, the people with as low as 25 to 30 years, the cholesterol starts depositing, the calcium starts depositing, because of the poor lifestyle, because of smoking, diabetes, hypertension, obesity, inactivity. A lot of things are there, a risk factor. So this cholesterol starts depositing inside the arteries, and it keep on accumulating, layer by layer by layer by layer. So the day will come when when you are stressed out, or when there is a lot of whenever there is a, say, a lot of stress factor happens, or some kind of a say diabetes patient or somebody who is smoking. So what happens is that cholesterol which is there inside the artery as a lump, that that is actually when it gets deposited, it gets covered by one layer called a lipid layer. It is a very thick layer. But people who are having smoking, people who have a stress factor, diabetes, that layers gets thinned out, and then ultimately it bursts. And when it bursts, it is just like a molten lava inside that coronary artery or the pipe. There, once this molten lava kind of things, lipid layer goes and touches the blood, it will become like a jelly, and people will come with a 100% block of one artery, that is called a heart attack. So definitely, it is a relation is there, but if you see the statistics, most of the patients, 50% of populations, they will have a normal cholesterol on the day of heart attacks. So it is not a rule of thumb that high LDL and heart attack. That's the reason why we are telling heart attacks are multifactorial. It is not only one cholesterol, but it has diabetes, obesity, hypertension, stress. So what we are advocating is LDL cholesterol is the very important cholesterol, and which is a major contributory factor for the heart attacks. So, if the person is having a high cholesterol in the family or a high cholesterol in himself, he or she should be get evaluated by their physician or their cardiologist and get treated either by medicine or with exercise or lifestyle modification.
Of course. Now, if we take a look at the recent studies and the recent charts, we have many young people facing heart attacks. Now, what could be the reasons for this and how can this be prevented, in your opinion?
See, if you see the today's generation, the lot of the work pressure is extremely high. If you see
Yeah,
the work pressure earlier and the work pressure now, the competition has gone up. The MNCs have come, the corporates have come. So we have a target oriented work now. So it happens in all the field. I'm not talking about a single field. So when you have a target to achieve, so you start to do what is there, what is the potential, and you try to double pedal it and then try to achieve that. So in that process, what happens is you are first of all stressed out. Second, because of the stress, the BP goes up. As the BP goes up, you try to avoid your food. You don't exercise properly. Then there will be a lot of other things. Like people used to smoke just to get out from the stress level, and people used to take alcohol to get out of the stress level. Activity is zero. So all those things actually put a big risk to the youngsters. And not only that, this what I generally say is the people who are having this borderline. See, many people who have working in a sedentary lifestyle. Say, suppose people who are sitting from say 10 hours, 11 hours a day, they don't exercise, so the BP will be borderline. Many a times we used to ignore that. We say that okay, fine, my blood pressure is 140/90. What is the big deal? I know I can just it's nothing much, but that is only going to cause a problem in future, because that is the precursor of the future cardiac problem. That borderline blood pressure, that borderline heart, the sugar can only aggravate, it will not regress. So in that case, the people, and the other thing is a family history. People who are having a strong family history of a sudden cardiac death in the family, or father, mother, brother, sister, any relation, any first line relation having a heart attack very, very recently, or maybe any time, you have the risk of having an attack. Not only all the kids and kin will have it, but you have a risk of. So you may get, you may not get. See, if your lifestyle is good, you may not get. But having said that, we Asians have a very high tendency to get a cardiac in terms of, say, if you compare the Western world, the Asians are much more prone for coronary artery disease. We have a atherosclerotic gene also. So in that process, what happens is we tend to ignore everything, and then we try to achieve the thing what we should achieve. In that process, we lose our health. That is very, very important, and there lies the problem. Once your health is lost, once you get a problem like a diabetes, blood pressure, you get addicted to drinks or say smoking, then there is no returning back. Then ultimately it will culminate or it will end up in a heart attack. So I would request my youngsters, my young friends, my young brothers and sisters that like refrain from all those things. Try to get some time to go for a walk, try to reduce your obesity, check your blood pressure, sugar, check with your doctor, have a healthy food, don't eat junk food. Junk food once in a while is okay, but not on a daily basis. So at this young stage, if you don't, curb the situation, then you are going to land up in at the age of 40 or 45. Definitely, you are going to land up in a major cardiac crisis.
Yeah. So of course now,
And
since
one
the
more
dawn,
thing, which
yeah,
sorry to interrupt. One more thing I would like
yeah,
to interrupt is many youngsters are now going for the gym work. So if we see a lot of people, collapsing in the gym while doing the gym. So there are basically two, three reasons why it happened. A sudden surge of the blood pressure when you are not accustomed to. Suppose you go and do a gymming work and which you try to lift a heavy object, heavy weight, and then suddenly you collapse. That's because
yeah,
the heart is not adapted to the strong, the stress what it should be normally. So if you warm up your heart, if you go slow, if you start warming up, start doing a routine exercise, and then you go for a gym, then probably you can avoid this crisis. Second thing is, if you have a strong family history, first before hitting the gym, please try to evaluate with your physician or your physician or your cardiologist. Check your cholesterol, check your thyroid, check your sugar, check your blood pressure. See to it that you are fit for the procedure. Don't go and hit immediately the gym. Third thing is there is something called as a plaque rupture. So what happens is there will be plaques inside. As you know, it's a part of the process, the aging process. And then you go and do a heavy stress, heavy exercise in the gym, and suddenly that plaque gets ruptured, and then it will behave like a heart attack, and then patient drops dead. So my advice will be to go slow on it. I'm doing this. Keep it. Yes, please. Yeah, I'm audible.
yeah, you're audible.
Any other question you want to ask?
Yeah, of course. So now, when you're talking to the gym about all of this, now, what exactly now has the improvements been taken? Because, like as I told earlier, like there's a lot of young people who are getting heart attacks, they're dropping dead, and of course, old people as well. Now, since the dawn of the first World Heart Day, now what are the various medical developments that have taken place since then?
See, medical science has evolved like anything. If you see the type of medical work which has happened in 2000 and now it is 2024, I mean, gone are the days where there were no like very rarely very few centers has to were doing an emergency procedure. So the change in the treatment is how we treat the heart attacks. See, earlier
Yeah,
days, patient who used to come for a heart attack, the treatment is rest, 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 and rest. Okay, so there were no facilities like an angiogram, angioplasties earlier. Now, slowly, once the angiogram, angioplasty started, so they were not doing the emergency angiogram and angioplasties. Whenever a patient used to come, they used to give a medicine called a very thrombolytic therapy, and they were keeping the patient for 1 or 2 days or 3 days, and they were choosing the patient, doing the angiogram, and then if required, most of the patient used to go for the bypass surgery. Angioplasties were given a very second line treatment. But as and when the number of the quality the medical sciences has evolved, so now what is happening is whenever a patient is coming with an heart attack, the first and foremost treatment what we do is we evaluate the patients within 5 to 10 minutes. Whenever a patient reaches a hospital, within 5 to 10 minutes is the evaluation. Within another 10 minutes the patient will be shifted to the cath lab, and within another 20 minutes the angioplasty is done. So if you see the door to balloon time. Door to balloon means the patient who is coming to the hospital is called door, and balloon is when we do the angioplasty. The normal American College of Cardiology Association, though the guideline is 90 minutes, but when we are doing in our centers or many centers like that, we are trying to see that you can cut short it as less as 30 minutes or 40 minutes. So what happens is the heart which is dying because of the heart attack, now the patient goes home with a very normal heart. So that is the advancement, or that is the treatment what has taken off in a very nice way. Now we are happy that most of the centers are doing this treatment, which was not done. This treatment was never given as the first line treatment, say 5 or 10 years down back. The other thing what it has come is not only the coronaries, but also the structural thing. Structural means, suppose a patient who is having a valve problem, suppose a patient who is having an aortic valve problem, suppose a patient who is having a mitral valve problem, all those kind of patients, young patients, definitely they need a surgery, they are going for the surgery. But what if suppose a patient is say more than 70-year-old? What if suppose a patient is having an 80-year-old? The patient cannot take the risk of the surgery, that pressure the patient cannot take. So now we are doing something called as a TAVI. TAVI means the transcutaneous aortic valve replacement or implant, or a mitral valve, or could also mitra clip. Mitra clip means we used to go inside and then clip that mitral valve leaflet. So basically, these are the recent advances what we are doing on a regular basis. But basically, we cannot offer this treatment for everyone. It's a small subset of patients which you used to target. And yes, people who are not able to undergo a surgery, or the risk is more in that care category of patients, this structural intervention has gone, like it has gone into in a very high fashion, and patients are getting better. A surgery, when it takes a 7 days recovery, we are doing a TAVI and the patient is going home the subsequent day. So it is the beauty of that. But having said that, as I told you, it is for a specific subset of patients. Not only that, the if you see the other aspect of it, if you see the other aspect of it, the say the arrhythmia part, a lot of the electrophysiological studies have evolved where any kind of arrhythmia can be treated by electrophysiological studies or RF ablation. Now, if we see the other aspect of it, like congenital heart diseases. Earlier days, congenital heart diseases were not being treated, but nowadays congenital heart diseases are being treated. So the patients who have a failing heart, the pumping function is 20%, 30%, 15%, 10%, who are going to die. Those kind of patients are being treated by something called as a left ventricular assist device, LVAD or RVAD. So these are the newer devices, and the last option is transplant, the heart transplant. Earlier days, heart transplant we used to read in the books, but now we are seeing on a daily basis the heart transplants are being done, and days are not far off where we can actually have a wearable devices. Like now we have a something called, see, earlier days pacemakers were being used with a lot of
Yeah.
wires and all those things inside. But nowadays, leadless pacemakers have come where there won't be any pacemaker leads. So what happens is it is the patient's comfort as well as the technology. And now, as you know, AI is taking the lead in the medical field also. So the accuracy as well as the scientific the data, it says that the accuracy is going to be 100%. So now we have, as you know, the robotic surgeries in the surgical field. Now we have robotic angioplasties and robotic transplant and all those things are also coming in a big way. So days are not far off where we will not be, we will be sitting in our console room and then playing with a joystick, and then angioplasty will be done. So this is going to be the future. So I think it has gone in a very, very, very higher level. Those what angioplasty or what the cardiac treatment which was happening some 20 years back, it is just gone obsolete now. And we are and good part is that many youngsters, many young cardiologists are taking up that challenge, and then they are learning and imbibing, and then they are implementing or executing in the field. That is a good part.
Yeah. So, of course, we spoke about the developments, we spoke about the link, the significance, as well as the reasons why, young people are facing these issues. Now, my final question is going to be now, how can we maintain a healthy heart? And is there any specific diet plans we should maintain for the same?
Of course, see, I give a very funny example of an auto. If you see an auto has three tires,
Yeah.
three tires. So like that, in that one is drug, and then one is exercise, and one is diet. So anyone goes down, then the auto is going to tumble. So similarly, our system is like that. That each is interdependent. Diet plays an extremely crucial part in not only you cannot say that if you take vegetarian diet, you are not going to have heart attacks. Then the eastern belt, which are not taking non-vegetarian states, will be having less number of heart attacks. It's not like that. It is the balanced diet what generally keeps us healthy. So people who are taking lot of oily stuffs, people who are taking lot of fried items. See, there is a lot of controversy about the ghee and all those things, but still,
Yeah.
we should not take a saturated fatty acid. Rather, we should take a polyunsaturated fatty acid. So, if you see the oil also, there are a lot of controversies that which oil to choose. But then, if you see the current guidelines, the what to say, your olive oil remains at the top and the coconut oil at the base. So
Yeah.
similarly, all the like whatever oil you use. So the basically the diet should comprise of carbs, proteins, as well as the minerals or whatever it is. So our carbs should be less, protein should be more. So in that case, suppose people who are taking, say, more of dairy items, dairy products, that can be reduced. And people who are taking less of, the nuts, legumes, and all those things, that can be increased. You can take a lot of vegetables, lot of fruits can be taken. Lot of fruits has a very significant value, because if you say the citrus fruits, if you say it has a
Yeah.
lot of antioxidants, uh, and even if suppose people who are taking meat eaters, they can have in moderation. Like they can take chicken, they can take fish, they can take egg, but in moderation. People who are taking lot of say items which are more of something like a salty items, they can reduce the salt. The current recommendation of salt is less than 5 gram per day. So literally, it is very difficult to say that you cannot measure the salt on a daily basis. So generally, what we advise is whatever salt you are using it, make it half salt, and then people who want to use additionally, patients, non patients who are not, people are not patients, say younger people, they can have a little less, but still the junk foods and all those things which contains a lot of hidden salts can be avoided. And basically the food should be more of a vegetables, and it should be a mixed food, and it should be a balanced food. So yes, diet plays a major role in reduction of the coronary artery disease. Not only that, diet also reduces the blood pressure. Diet also reduces the sugar, and diet also reduces the obesity. So diet actually is the what to say the initial thing where you can have you can check the complications of sugar, pressure, obesity, and cardiac disease.
And that officially brings us to the end of today's show. A huge thank you to Doctor for joining today's show and imparting us with that valuable knowledge.
Thank you so much. Thank you so much for giving me this opportunity to be in this platform.
Thank you so much, Doctor.
Thank
And
you.
remember that, yeah. And remember, guys, we air on Mondays at 4:30 p.m. That's it. If you guys want to contribute to our topics, have any questions, or just want to tell us what an amazing job we're doing, you can reach out to us at 6364252164. And a huge thank you to our listeners for tuning in to this edition of the Reality Bank, your weekly dose of youth power, brought to you by FEBA Online. This is RJ Yohann. Hope you have an amazing week.